Dr. Henderson again, talking about a different procedure. In this video, we'll talk about a robotic-assisted laparoscopic pyeloplasty. Pyeloplasty is just reconstruction of the pelvis of your kidney. Sometimes what can happen is most of the time your kidney will come down like a nice funnel into the ureter or the tube that it drains urine into. Occasionally, where that pelvis of your kidney attaches to the ureter underneath can get really tight here. It can either be scarred down, and this can be something you're born with, or occasionally there's actual vessels on the outside that sit over that and kind of squeeze off the area where the ureter enters into the kidney so the urine can drain. If you ever get that, it can be signs or symptoms of pain on that side. They end up getting a CT scan or an ultrasound. And that's where we usually can see, hey, their kidney's obstructed because it's really tight and narrow or scarred down in that area. When we go in now, laparoscopically, compared to what they used to do before, which was an incision from the front to the back to fix this problem, now we go in with 3 teeny tiny incisions, 1 by your belly button, and then 2 near the side of whichever kidney side we're going to perform the pyeloplasty or reconstruction of the pelvis. They call it a UPJ obstruction or uretero-pelvic junction obstruction. So the obstruction's right there in the middle where the kidney's connecting. And all we do is go in laparoscopically with this neat robotic platform. So it's microscopic dissection, 30 times magnified, very minimal trauma to any of the tissues. So the blood loss is teeny tiny, like 5 to 10 milliliters most of the time. We go in and I'll cut out that area, and then I open up your ureter and sew it back to your kidney. Sometimes I'll even reconstruct the kidney pelvis if it's too dilated, because you don't need all that dilated tissue. You want it to come down in a filter like I explained so that everything drains appropriately. The procedure is about an hour and a half, 2 hours max. The worst part about the whole procedure is we usually do put a stent in there. A stent is like a little straw that's hollow in the middle, and it goes all the way from your kidney down to your bladder. They used to keep this stent in for 6 weeks. Now that we can do this continual suturing with the robot instead of interrupted sutures like we used to do when we did this open, the anastomosis, or the area where we connect the ureter back to the kidney that keeps it open, is a lot better closure. So we don't have to worry about as much repeat scarring in this area. When that happens, they usually keep the stent in longer. Now we just keep it in for 3 weeks. They used to keep it in for 6 weeks before. After the procedure, you're admitted to the hospital. 99% of my patients go home same day. There is not a lot of pain with this because of the 3 little incisions. The biggest pain from this is just the irritation from the stent. And stents are terrible. It's like a chronic dull ache on that side. But it is doable to get you through that, so we can bring you back to the office in 3 weeks. We take out the stent, and then in 2 months, we repeat what you probably would have already gotten before the procedure. That's called a nuclear renal scan. It's just to show that the imaging doesn't show there's any more obstruction in that area. Also checking to make sure that your pain has improved, that it's not getting worse. You can have recurrence, but usually these pyeloplasties are around 97% effective. 3% of the time, you can get recurrence of that scar tissue, and then we'd have to go back in, do the whole procedure over again. That's very rare. But it's a great procedure. There's not a long recovery for it. And with any laparoscopic procedure, they'll tell you no bath, no hot tub, no pool for about 2 weeks, and no heavy lifting, nothing more than a gallon of milk for about 4 weeks. Just so you don't pop out hernias. Other than that, most people are back to their normal activities, work, things like that, with lifting restrictions until the 4 weeks. And at 4 weeks, you can do whatever you want. Everybody's thrilled at the 3 weeks time before that just to get the stent out. Other things to anticipate afterwards is you can have some blood in your urine the whole time the stent's in there. That'll be kind of normal. That's really kind of it. Not a ton of complications or issues from this. Biggest one is just going to be recurrence of that scar tissue that doesn't happen often. It's one of my favorite procedures to do because patients do so well afterwards.